So today we're going to focus on tightening of the abdominal skin. As we grow older, we all know that we're going to lose collagen and elastin in the skin, and that's also happening in the abdominal area. And especially with women who gave birth, this might be a problem area where they find themselves looking at themselves aesthetically unpleasing in this area as well. Now, there are several options to treat this, but today we're going to talk about hyperdiluted calcium hydroxylapatite, which is a subtle way to tighten up the area of the skin area of the abdomen. Now, today we have with us a 33-year-old woman who gave birth to a wonderful son 2 years ago, almost. And she, of course, still has a really pretty belly. But as you might notice, there is some laxity of the skin occurring. Now, looking at the abdomen as well, we don't see any scar tissue and we don't see a lot of stretch marks resulting from the birth, but it's getting more loose. So this is an excellent indication for calcium hydroxylapatite because it's minimal invasive and it's relatively low in complications. The adverse events that might be occurring are bruising and local pain, but they're all mild and transient and don't need any medical intervention to resolve. All right, so we already disinfected the skin once, but we're going to start making our markings now. First with the outer borders. The top border is at the lower part of the rib cage, something like this. Then we go to the side borders of the abdominal wall, all the way down to the bikini line. So this is going to be the full area that we're going to treat, and we're going to mark the boxes of 4 by 4 centimeters, because that's twice the length of the needle that encompasses with the syringes of the calcium hydroxylapatite. Something like this. All right, perfect. And also horizontally. So now we're doing some basic calculus. So we have 1, 2, 3, 4, 5, 6, 18 boxes, areas that we're gonna need to treat. And we all know that 1 syringe of calcium hydroxylapatite, you can treat about 100 square centimeters. So 18 times 4 is about 300. So we need about more or less 3 syringes to treat this full area. And we're already looked at the thickness of the skin, and this is perfect treatment to do a 1 to 2 hyperdilution of the calcium hydroxylapatite. Dit hoeft er niet op, toch? So, if the patient wishes to have some extra anesthetics, you also can apply some anesthetic cream before the treatment. Then mix your calcium hydroxylapatite before you start, so it can actually do its work a little bit. So apply thickly and just leave it set for a couple of minutes before you start doing your treatment. We're first going to start with the retrograde linear thread technique, and I'll later on show you also how to do it with a fanning technique. Right, are you ready? Okay, so we're going to start here at the top, and it's easiest to stretch the skin a little bit and inject in a slow fashion. So try to stay in the subdermal junction area, and we're going to make linear threads of about 0.05 per thread. Again, retrograde linear threads. It's important to stay in the correct anatomical layer, because if you go too deep, you end up in this subcutaneous layer. And there are no fibroblasts over there, so you want to really hit those fibroblasts to activate them and produce some collagen. If you get too superficial, then you might see any deposits through the skin, which is aesthetically unpleasing. Because you're making a lot of puncture wounds, don't forget to change the needle every now and then, so the tip of the needle won't get blunt and you will cause extra pain to the patient, which is unnecessary. We just did our basic calculus math, and we calculated that we needed 3 syringes. So basically every line needs 1 syringe. And because we hyperdiluted it in a 1-to-2 fashion, you can say that 1 syringe per 2 squares is necessary to treat her. So I already did one side and I will just go work my way back. So I will make a little bit of a cross hatching as well. So it will spread out nice and evenly throughout the skin. Kom together, 2. Sorry, schat.